We are here today to complete a training video on the use of the TheraSphere Administration Kit, the TheraSphere Accessory Kit, also known as an administration set or a tubing set, the TheraSphere Checklist, and to complete one mock infusion. The TheraSphere Administration Kit is an acrylic box designed to minimize the radiation exposure to the participants during a planned administration. It consists of a 3-piece acrylic box, the base, a top shield, and a side shield, a stainless steel extension arm that can be removed for easy cleaning, a bag hook for hanging a bag of saline, a beta shield for temporary storage of the waste container, and a RADOS electronic dosimeter for radiation monitoring of the administration set and dose file to determine when optimal delivery has been completed. All pieces of the administration kit are reusable, with the exception of the waste container as shown here. The TheraSphere Administration Set, or tubing set, is a single-use delivery system designed to deliver the microspheres to the target tissue. Note, there are 3 key sterile connection points that need attention. They include the spike for the saline bag, the tip of the needle injector assembly, and the connection between the outlet line and the microcatheter. As seen in this demonstration cutaway, the TheraSphere dose is supplied in a 1 ml V-bottom glass vial in 0.6 mLs of sterile water, and for this visual, you can see the white microspheres. The glass vial is secured within a 12 millimeter clear acrylic vial shield. The TheraSphere dose vial remains sealed within this clear acrylic vial shield during the treatment preparation process. During the dose preparation process, we will expose a removable plug at the top of the dose vial shield to provide access to the dose vial septum. The lead pot provides additional shielding of radiation. The TheraSphere Administration Checklist is a 2-page document that provides a recommended process for preparing for a patient injection. As this is formatted in Word, it can easily be modified based on your institutional preferences. And lastly, for your training purposes, we will complete one mock infusion. As you can see at the top of the administration checklist, we have provided an area to record basic patient information and the TheraSphere treatment plan. This checklist requires a patient name, medical record number, treatment date, treatment site, TheraSphere dose vial size, TheraSphere dose lot number and vial number, the Y-90 activity at time of treatment, and the lot number and expiration date of the TheraSphere administration set. As this checklist is often saved in the patient records, it is recommended that it be completed in full. You will note that the checklist provides an area for recording of catheter information. Please note, the general recommendation is that your high-flow microcatheter have an inner diameter greater than or equal to 0.5 millimeters, 0.020 ID. As we move through the 2-page checklist, you will see there are 10 required tasks to complete a TheraSphere administration. On the left side of the document, you will see the brief tasks required for completion, as well as the individual steps involved for each. On the right side of the document, if needed, you will see more detailed explanation of the steps and best practice recommendations. As you can see from the TheraSphere administration checklist, the first task is preparing the patient. We list 3 recommended steps for this process. It is recommended that the checklist be read to you and that as you complete that step, you verbally confirm its completion and your reader places a check in the box provided. We confirm the patient identity for treatment, requesting at least 2 methods of patient identification. When completed, we simply check the box. We confirm the patient prescription, i.e. the written directive for TheraSphere, and the plan for treatment. Lastly, we measure and record the baseline radiation level from the patient before treatment. This completes the task for preparing the patient. As you can see from the checklist, the next task lists the supplies that are required to complete a TheraSphere administration. First on the list is a GN contamination meter, which checks for low levels of radiation and is used to locate possible contamination. Note, although it is not listed here, sites may use an ionization survey meter to measure high doses of radiation and is best used to measure the dose rates from the TheraSphere vial. Next is a radioactive spill kit, which is generally stored in nuclear medicine. Signs for doors advising that radioactive materials are in use are required. You will be required to apply a floor cover under the treatment area. You will prepare a movable cart which will contain a number of accessories as well as the TheraSphere components previously described. You will first see that we cover the movable cart with a sterile drape. We will then gather the required supplies, most of which are sterile, to include sterile towels, sterile gauze, a bag or bottle of saline, an optional forceps or tweezer, an adhesive strip, i.e. a Steri-strip, alcohol disinfectant or an alcohol swab, scissors, and a hemostat or Kelly clamp. Please note, for this demonstration, the items have been removed from their sterile packaging. As you know, the bag of saline and alcohol swab are not sterile. You will also see listed on the non-sterile right side of the checklist the previously described components to include the TheraSphere administration set, the TheraSphere administration kit, where we will need to remove the top shield and side shield, fully extend the stainless steel arm until it locks in place, and then install the saline bag hook on the side of the box. The Rados electronic dosimeter will be turned on by depressing the black button once to display the dose rate value, i.e. MR per hour. And then the Rados is clipped to the back of the acrylic box as shown. The final supply that we need is our waste container in its beta shield, which you see I have off to the side with the other unopened items. This completes the preparation of the treatment room and equipment. The next task requires us to open and prime the TheraSphere administration set. The administration set will be opened by a non-sterile assistant and removed from the packaging by the sterile individual. Be reminded, this is a 2-piece set consisting of a tubing set and the empty 20 ml amber overflow vial. Upon removal from the packaging, open the tubing set so you can visualize the entire length of the set and place it in the general area where the pieces will fit in the administration kit, meaning that the saline spike and syringe will be near the left side of the box and the remaining tubing and amber vial towards the right. As described, we will connect the non-vented spike to the saline and hang the saline bag on the hook. As previously mentioned, this is one of the sterile connection points and will require an assistant if I am to remain sterile. We will then connect the vented spike to the empty glass vial and simply return it to the cart. Next, we will open a sterile towel and place the needle injector assembly on that towel. As previously mentioned, this is the second sterile connection point for the administration set. So I will remove the red rubber cap from the assembly tip and place both components on the sterile surface. To prime the tubing set, we slowly pull the plunger back to draw saline into the syringe. Invert the syringe to point the tip up and begin priming. If I see bubbles in the syringe, I will use my finger or a hemostat to tap the syringe and move the bubbles to the top. I advance the plunger forward to expel all air out of the syringe, and we begin to prime the tubing set and needle injector system. Note, it is important to see 2 streams of saline from the tip of the needle injector assembly and to confirm the entire system is primed with saline. Note, it typically requires 30 to 40 cc's of saline to completely prime the administration set, so the syringe will need to be refilled for the subsequent flush. I will complete a final inspection of the syringe and tubing set to confirm I have removed all air from the tubing set. I will refill the syringe with saline when priming is complete. This completes the administration set priming. The next task is the dose vial preparation. This process is typically initiated by the nuclear medicine technologists or radiation safety staff, who will lift the lead pot and lid, tilt the TheraSphere dose vial back and forth to wet the dose vial septum, and firmly tap the lead pot on a hard surface. The lead pot and lid, with the dose vial inside, will be placed in the holder in the base of the acrylic box. The lead pot lid will then be removed and placed upside down in the corner of the acrylic box. At this point, we are ready to prepare the dose vial for administration. Note, as some of the dose vial components that will be shortly removed may have come in contact with microspheres, care should be taken to handle them properly. Specifically, the next 3 steps will require disposal into the waste container in its beta shield. In preparation for these next steps, the lid will be removed from both the beta shield and the Nalgene waste container, and the waste container will be kept near the dose vial preparation site. First, I will take my hemostat and remove the purple seal from the TheraSphere dose vial. Note, as I have already removed the side shield from the acrylic box, I have easy access to the dose vial. You will also notice that I have aligned the tab of the purple seal with the saline bag hook, allowing me to easily reach into the lead pot, close the hemostat on the tab, and pull it straight back for removal from the dose vial. The tab will be discarded in the waste container. The next step is to use a hemostat and steri strip to remove the dose vial beta plug to expose the dose vial septum. Simply prepare your steri strip, grasp with your hemostat, and lightly touch the surface of the beta plug with the steri strip to remove it from the dose vial. The plug will be added to the Nalgene waste container. Keep in mind, it is important to understand that upon removal of this acrylic plug, there is no longer beta protection in that location. Lastly, an assistant will provide a sterile alcohol swab, which will be used to disinfect the dose vial septum. Upon completion of this step, the alcohol swab will be added to the waste container. This completes the dose vial preparation. The next task is to place the previously primed administration set into the acrylic box and attach the needle injector assembly to the recently prepared dose vial. Both the TheraSphere administration kit and administration set are pre-labeled with A, B, C, D, and E for easy alignment. To complete this step, control the needle injector assembly in one hand to maintain sterility, and I will lift and place the amber overflow vial in the holder on the outside of the acrylic box and push the overflow tube into gripper clip at the location labeled A. Next, move the needle injector assembly into the administration kit. Directly line up the assembly over the dose vial and connect the needle injector assembly to the dose vial by pressing on the green cap to click and lock in place. Next, place the tubing through slots B and D on the acrylic box and slide the fitting into the holder at C. Finally, close the tubing set at label C. This step can be accomplished with a hemostat or a blue pinch clamp if provided on your administration set. This concludes the assembly of the administration set and dose vial. The next task is the final assembly, and this action is completed just prior to administration. The first step of the final assembly process is to close the pinch clamp on the outlet tubing near label E. The next step is to advance the needles through the dose vial septum. This action is accomplished by pushing down on both yellow tabs and advancing them to the bottom of travel. Note, you will hear a click as the needles begin their downward movement, and you will hear a second click when the needles have been advanced to the bottom of travel. At this point, we reassemble the acrylic box by replacing the side shield and next the top shield with the slope facing D. We make one final check to be sure that the tubing is not pinched or kinked at B or D. The patient table is lowered and we move our administration cart close to the bed. An open sterile towel will be placed under the extension arm at label E, and a second sterile towel will be placed across the gap between the administration kit and the patient table. The interventional radiologist will verify the microcatheter position with contrast and then flush with saline to ensure appropriate flow. The interventional radiologist, IR, or the authorized user, if different than the IR, will disconnect the outlet tubing labeled E from the holder at C and firmly connect the microcatheter, ensuring a tight connection. And finally, we place the microcatheter in the holder on the extension arm with the outlet tubing labeled E above the holder and the infusion catheter hanging vertically below. This concludes the final assembly process. The next task is the actual TheraSphere administration. Attention, beta radiation from the tubing and exposed catheter is very high during sphere transfer. Stand behind shielding, maintain distance. Prior to administering the TheraSphere dose, we will open the white pinch clamp from the outlet tubing labeled E and massage the tubing with your fingers to relieve the dent in the tubing. We record the initial reading from our radios dosimeter to be read in MR per hour. We record the starting time of the administration. Please note, during the actual administration, the physician injecting TheraSphere will observe the overflow vial for an initial pressure to force a few drops of saline into the vial and the microcatheter outlet tubing connection for leakage. These points will be described shortly. The next step is to administer the TheraSphere Microspheres, maintaining a steady pressure on the plunger and flushing the syringe at a rate greater than or equal to 20 cc's per minute. It is normal to see a few drips of saline into the amber vial, as this indicates that you are pushing at the upper end of the pressure range. If a steady stream of saline is observed being diverted into the amber vial, a slight reduction in pressure is suggested. Note, maintain constant pressure to complete the 20 cc injection. Also note that flushing at less than 20 cc's per minute may result in poor administration efficiency. Refill the syringe and repeat the flush 2 more times for a total number of 3 flushes or 60 cc's. Record the number of flushes completed. Record the completion time of the administration. Record the final dosimeter reading. This concludes the TheraSphere dose administration. The next task is the disassembly of the administration kit and administration set. The first step requires you to cut the tubing to separate the priming portion of the tubing from the inlet line shown as line B. As shown, we take our scissors to cut the tubing at the indicated position. Next, my assistant will open the administration kit by removing the top shield and the side shield. The interventional radiologist will close the pinch clamp on the outlet tube near label E. The interventional radiologist will then remove the catheter from the patient using care to control the tip. The suggested technique for this removal is to pull your microcatheter into your base catheter and remove both catheters together. When the catheter tip is removed from the patient, it should be immediately controlled in gauze or a sterile towel. After gaining control of the tip, the catheter length is gathered in a sterile towel. As shown, place all potentially contaminated items into the waste container in its beta shield. Note, these items include the infusion catheter and the base catheter with the attached tubing and towels and gauze, the dose vial with the attached needle injector assembly by lifting the lead pot and dumping out the dose vial, and other possible contaminated items such as towels and the IR's and/or the AU's gloves. Next, check the IR's or AU's hands for radiation and survey all staff leaving the room. This concludes the disassembly task. The next task is the cleanup. The first step is to close the waste container and beta shield. Using a survey meter, check for microspheres on the cart, the empty lead pot, equipment, and the treatment area. Then clean the acrylic box with a soft, clean cloth and can use alcohol, peroxide, or chlorine bleach disinfectant as required. Lastly, we turn off the electronic dosimeter and store all parts of the accessory kits for reuse. This concludes the cleanup task. The final task for completing a TheraSphere administration is to measure and record the final radiation field from the patient after treatment.